Salbutamol, commonly known by its brand name Ventolin, is a medication primarily used to treat asthma and other respiratory conditions. This bronchodilator works by relaxing the muscles in the airways, allowing easier breathing and relieving symptoms like wheezing and shortness of breath. But the benefits of salbutamol go beyond asthma relief. From chronic obstructive pulmonary disease, COPD, to exercise-induced bronchoconstriction, IBD, salbutamol has proven to be a versatile and essential drug in managing respiratory disorders. Common uses of salbutamol. Salbutamol is most commonly prescribed for the treatment of asthma. Asthma is a chronic respiratory condition characterized by inflammation and narrowing of the airways, leading to symptoms such as wheezing, coughing, and difficulty breathing. Salbutamol acts as a bronchodilator, relaxing the muscles surrounding the airways and allowing them to open up, thereby improving airflow and alleviating these symptoms. Aside from asthma, salbutamol is also used for the management of chronic obstructive pulmonary disease, COPD. COPD is a progressive lung disease that includes conditions such as chronic bronchitis and emphysema. Salbutamol can help relieve symptoms such as shortness of breath, coughing, and wheezing in individuals with COPD. Another common use of salbutamol is for the prevention and treatment of exercise-induced bronchoconstriction, IBD. IBD is a condition in which physical activity triggers the narrowing of the airways, resulting in symptoms similar to asthma. Salbutamol, when taken prior to exercise, can help prevent or reduce the severity of IBD symptoms, allowing individuals to engage in physical activity without respiratory difficulties. Advantages of using salbutamol. One of the key advantages of salbutamol is its rapid onset of action. When administered through inhalation, salbutamol can provide quick relief during asthma attacks or episodes of shortness of breath. The medication works by directly targeting the airways, allowing for faster absorption and immediate relaxation of the smooth muscles. This makes salbutamol an effective rescue medication for individuals experiencing acute respiratory distress. Salbutamol is available in multiple formulations, including inhalers, tablets, and syrup, making it convenient for individuals of different age groups and preferences. Inhalers are particularly popular as they deliver the medication directly to the lungs, ensuring maximum effectiveness. Tablets and syrups, on the other hand, are more suitable for individuals who have difficulty using inhalers or for those who require a longer-acting form of salbutamol. Potential adverse effects of salbutamol. While salbutamol is generally safe and well tolerated, it can cause some potential adverse effects. The most common side effects include increased heart rate, tremors, and headaches. These effects are usually mild and temporary, resolving on their own without any intervention. However, if these side effects persist or worsen, it is important to consult a healthcare professional for further guidance. In rare cases, salbutamol may cause more severe side effects such as chest pain, irregular heartbeat, or allergic reactions. If any of these symptoms occur, immediate medical attention should be sought. It is essential to be aware of these potential adverse effects and to discuss any concerns with a healthcare professional before starting salbutamol treatment. Dosage guidelines for salbutamol. The dosage of salbutamol can vary depending on the individual's age, condition, and severity of symptoms. It is essential to follow the recommended dosage guidelines provided by a healthcare professional to ensure optimal treatment outcomes and minimize the risk of adverse effects. For asthma treatment in adults and children over 12 years old, the typical starting dose is 2 inhalations, 100,200 mcg, every 4 to 6 hours, as needed. The maximum recommended dose for adults is 8 inhalations, 400,800 mcg, in a 24-hour period. Children under 12 years old may require lower doses based on their age and weight. For the prevention of exercise-induced bronchoconstriction, a single dose of 2 inhalations, 200 mcg, should be taken 15 to 30 minutes before physical activity. This dosage can vary depending on the individual's response and the level of exercise intensity. It is important to note that these dosage guidelines are general recommendations, and individualized treatment plans may be necessary. Always consult a healthcare professional for accurate dosing instructions tailored to your specific needs. Precautions and dangers of using salbutamol. While salbutamol is generally safe and effective when used as prescribed, there are certain precautions and potential dangers that should be considered. Firstly, salbutamol should not be used as a substitute for long-term asthma control medications. It is primarily a rescue medication used for acute symptom relief. Individuals with persistent or frequent asthma symptoms should consult a healthcare professional for appropriate long-term management strategies. Secondly, Salbutamol should be used with caution in individuals with certain medical conditions, such as heart disease, high blood pressure, or thyroid disorders. It may exacerbate these conditions or interact with other medications, leading to adverse effects. It is crucial to disclose all relevant medical information to your healthcare professional before starting salbutamol treatment. Lastly, misuse or overuse of salbutamol can be dangerous. Exceeding the recommended dosage can increase the risk of side effects, including cardiovascular complications such as increased heart rate and arrhythmias. It is important to strictly adhere to the prescribed dosage and to consult a healthcare professional if symptoms worsen or do not improve with the recommended treatment. Alternative medications to salbutamol. While salbutamol is a commonly prescribed medication for respiratory conditions, there are alternative medications available that may be more suitable for some individuals. These alternatives include other short-acting beta agonists, such as levalbuterol, as well as long-acting beta agonists, LABAs, like formoterol and salmeterol. LABAs are generally used in combination with inhaled corticosteroids for long-term asthma management. In some cases, individuals may not respond well to salbutamol or may experience significant side effects. In such situations, a healthcare professional may recommend alternative medications or treatment options to achieve optimal respiratory control. Frequently asked questions about salbutamol. Can salbutamol be used for children with asthma? Yes, salbutamol can be used in children under the guidance of a healthcare professional. The dosage may vary based on the child's age and weight. Can salbutamol be used during pregnancy? Salbutamol is generally considered safe for use during pregnancy. However, it is important to consult a healthcare professional for personalized advice and guidance. Can salbutamol be addictive? No, salbutamol is not addictive. It is a short-acting bronchodilator that provides temporary relief from respiratory symptoms. Can salbutamol be used for coughs and colds? Salbutamol is not typically used for coughs and colds unless there is an underlying respiratory condition such as asthma or bronchitis. It is important to consult a healthcare professional for appropriate treatment recommendations. Conclusion: is salbutamol right for you? Salbutamol, also known as Ventolin, is a versatile medication that plays a crucial role in the management of respiratory conditions such as asthma, COPD, and exercise-induced bronchoconstriction. Its rapid onset of action, multiple formulations, and convenience make it a popular choice for relieving acute respiratory symptoms. However, it is important to be aware of the potential adverse effects and to follow the recommended dosage guidelines to minimize risks. Salbutamol should be used as a rescue medication and not as a long-term asthma control medication. Consulting a healthcare professional is essential to determine whether salbutamol is the right treatment option for you and to ensure proper guidance and monitoring. Remember, respiratory health is vital, and understanding the different aspects of salbutamol will help optimize its usage and promote better respiratory well-being.